This short video will explain the normal process of digestion, the minigastric bypass procedure, and how weight loss will occur upon completion of the surgery. In the normal digestive process, food travels from your mouth down your esophagus and into your stomach. Before surgery, your stomach can hold about 1200 milliliter of food. The food combines with digestive juices containing acids and enzymes that help break it down into smaller particles that are released into the first part of your small intestine, the duodenum. Most of the calories and the nutrient from the breakdown food are absorbed in the duodenum and jejunum, which is the second part of the small intestine. Food particles not absorbed by the small intestine leave the body in form of waste. The steps in the mini gastric bypass procedure involves placing 5 trocars in your abdomen, creating a narrow stomach pouch with an endoscopic stapler, measuring to a bypass point on the small intestine, creating an anastomosis between this bypass point and the small intestine pouch. Finally, reinforcing the anastomosis with sutures. The mini gastric bypass begins with the surgeon inserting 5 trocars into your abdomen. A trocar is a tool that has a hollow sleeve and allows your surgeon to pass a laparoscopic video camera and other endoscopic tools into your abdomen. This allows your surgeon to perform the operation from outside your body. Your surgeon will use an endoscopic stapler to divide your stomach into 2 parts. The smaller part that connects to esophagus is reshaped into a long narrow tube and will serve as your new mini stomach. It will only hold 120 to 175 milliliter of food. The large portion of your old stomach will remain alive inside your body. It will still produce digestive juices, but it will no longer come into contact with food. Next, your surgeon will measure the length of small intestine that will be bypassed. This bypass section will include all of the duodenum and part of jejunum and is usually between 5 to 7 feet from where the small intestine to the larger portion of your stomach. The length bypass is determined by your specific physical conditions and lifestyle situations. Your surgeon will then connect the end of your new mini stomach pouch to bypass point of the small intestine using the endoscopic stapler. This connecting point is called anastomosis. Once the connection is complete, your surgeon will reinforce the outer circumference of the anastomosis with sutures. Finally, the surgeon will close the trocar holes with sutures. Weight loss after surgery will occur for multiple reasons. First, your new mini stomach will hold much less food, causing you to fulfill more quickly. Therefore, you will eat smaller amounts. Secondly, once food leaves your mini stomach, it will bypass your duodenum and part of your jejunum. This means less calories will be absorbed by the food. However, digestive juices from the large portion of the old stomach and enzymes from the gallbladder will still travel through the duodenum and will meet up with the food at the bypass point. These acids and enzymes will aid in the digestion as food travels through the remainder of small intestine. Finally, certain hormones that regulates your appetite will be affected after surgery. Therefore, you will eat less not only because your stomach is physically smaller, but also because this change in hormonal level will suppress your appetite. The mini gastric bypass has many benefits over other bariatric procedures. These includes a shorter surgery and recovery time. It's more easily reversible and revisable and maintains patient satisfaction. All surgery presents risk. Weight, age and medical history determine your specific risk. Ask your doctor if bariatric surgery is right for you.